Hello, this is Rick Riordan. In this short video lecture, we're going to talk about the role of Hedis, what Ncqa is, and some examples of how this reporting is used to create report cards, and the role of HIM with Hedis and Ncqa. And again, we've been talking throughout this course about data, report cards, data visualization, and Ncqa and Hedis are another way of collecting data for quality measures and reporting. So these two key components cover the health plan or the payer side of data and reporting. So what is Ncqa? Ncqa, or the National Committee for Quality Assurance, is a nonprofit organization that's focused on improving healthcare quality. It accredits health plans and providers and develops performance measures that are used nationwide. And your Ncqa rating, or the number of stars you have, enable health plans to negotiate with employer groups higher rates. So very important for health plans to do well on their HEDIS measures. Which brings us to, what is HEDIS and why does it matter for health plans? What HEDIS is, it stands for the Healthcare Effectiveness Data and Information Set. It's used by most health plans to measure performance and compare plans based on standard quality metrics. HIM professionals contribute to HEDIS by ensuring data accuracy. There was some talk some time ago about how the role would diminish with electronic health records. And if anything, it seems to have actually increased, as we'll see. So there are over 90 measures, and these could be things such as provider credentialing, percentage of children that are prescribed ADHD medications and have a follow-up visit within 30 days. That's a measure. And these are updated and refined over time. And even though a lot of these things we can harvest using electronic healthcare records to follow up on when somebody had an A1C or cancer screening or immunizations. Not everything's in a data field, as we'll see. One of the things that's used with HEDIS is the administrative data. This is basically claims, billing, and counter level data, right? So an example of this would be somebody comes in for a blood pressure check. Depending on the electronic health record, it may say they came in for a check, but it won't necessarily, depending on the EHR vendor, have the actual reading. So very important to do some sort of record review, which brings us to the next slide. Terms of data integrity. Not everything is coded data. So a lot of times this requires HIM professionals to abstract medical data for reporting instead of relying solely on electronic administrative data. So the health plans submit the data yearly, and sometimes there are follow-up audits. This is a growing area, as we'll see, for HIM professionals, particularly new grads who want to get in the field and may not necessarily have a lot of extensive experience. We also have nurse abstractors and other clinicians who do follow-up audits as well and oversee some of this data collection and submission. So you can see here the different types of data. We talked about administrative data. Larger health plans sometimes will use a hybrid data approach where they'll have both medical record review and administrative data. And sometimes they'll take things straight out of the medical record itself. So you can see here we have a screenshot of electronic health record. And these are the types of things that sometimes get submitted with HEDIS data submissions. And of course, we talked earlier about report cards. Here's an example of one that I've de-identified, talking about patient experience, which is a big area for NCQA and for that matter, Hedis. So you can see here, this report card on the patient experience domain gives getting care easily 2 stars out of 5, satisfaction with physicians 1 star out of 5, and so on. And these are the types of ratings that the health plan will collect. And then when they sit down with employer groups, they negotiate the next year's rates. And then talking about data visualization, this is an example of a dashboard that was created with Tableau. You can see some of the things here in terms of regulatory concerns, privacy, cost, all these different types of data visualizations. We're starting to see more and more of these. And some of the benefits why we do this, we improve the patient experience, we improve care delivery, we get payers, policymakers, and for that matter, providers all on the same page in terms of what we should be collecting, what we should be evaluating, and so on. And these measures are, of course, are updated every year. And again, this is just something I harvested off of LinkedIn. You can see a lot of these things in terms of HEDIS reviewers, HEDIS abstractors, HEDIS managers. Some of these jobs are remote, some of them are inpatient, but in person, on site. Some of them involve management, some of them ask for extensive experience, some of them really ask for almost no experience. So this is an area that I want to make sure all of you were aware of as you look into launching your HIM career. And here's some additional resources that I used to create this, and then I will have some other resources posted on Moodle as well. I hope you found that useful as an introduction to NCQA and HEDIS. Please reach out if you have any questions about this material. Thank you.